When red cells are abnormally large, with an MCV above 100 femtoliters, the algorithm directs you to check vitamin B12 and folate levels. The most diagnostically important subset of macrocytic anemia is megaloblastic. The defining lesion in megaloblastic anemia is impaired DNA synthesis. Without adequate B12 or folate, erythroid precursors cannot replicate their DNA at the normal pace, but their cytoplasmic hemoglobinization continues unimpeded, producing large cells with immature-appearing nuclei. This is called nuclear cytoplasmic dissociation. The peripheral smear classically shows hypersegmented neutrophils with more than 5 lobes and oval macrocytes. If B12 or folate is low, the diagnosis is megaloblastic anemia. B12 deficiency is most often due to pernicious anemia, autoimmune destruction of gastric parietal cells with loss of intrinsic factor and failure of ileal B12 absorption, but also arises from strict vegan diets, terminal ileal disease, such as Crohn's disease or surgical resection, bacterial overgrowth, fish tapeworm, and chronic use of proton pump inhibitors or metformin. Critically, B12 deficiency uniquely causes subacute combined degeneration of the spinal cord, involving demyelination of the dorsal columns and lateral corticospinal tracts, and producing neurological symptoms that folate replacement will not reverse. This is why distinguishing between B12 and folate deficiency matters clinically. Folate deficiency arises from poor dietary intake, commonly seen in alcoholism and so-called tea and toast diets, malabsorption, increased demand during pregnancy or hemolysis, or drugs that block folate metabolism such as methotrexate, trimethoprim, and phenytoin. If B12 and folate levels are normal, the macrocytosis is non-megaloblastic, and the differential shifts to disorders that enlarge red cells through other mechanisms. Alcohol is directly toxic to erythroid precursors and often produces macrocytosis even before frank anemia develops. Liver disease alters the lipid composition of the red cell membrane, leading to enlarged cells and target cells on the smear. Hypothyroidism slows overall metabolism and erythropoiesis, producing a mild macrocytosis. Myelodysplastic syndrome is a clonal stem cell disorder of older adults featuring ineffective hematopoiesis with dysplastic morphology and a meaningful risk of progression to acute myeloid leukemia. Drug-induced macrocytosis occurs with agents that interfere with DNA synthesis, including methotrexate as a folate antagonist, hydroxyurea as a ribonucleotide reductase inhibitor, zidovudine, and several chemotherapeutics. Reticulocytosis itself causes a spurious macrocytosis because reticulocytes are larger than mature red cells. So any cause of brisk reticulocyte release, whether from hemolysis or recovery from blood loss, can elevate the MCV without true megaloblastic pathology.